Hi, good evening, everyone. Myself, Dr. Pramod, a nephrologist working in Davangere and also attached to SS Hospital. So, today I would like to discuss on pedal edema and CKD, what are the causes, symptoms, and treatment. So, welcome to today's session on pedal edema and chronic kidney disease. So today we'll be exploring what is pedal edema, what are its causes, how it relates to CKD, and the best ways to manage it. So first, let's see what is pedal edema. So pedal edema is a condition wherein extra fluid accumulates in the lower legs, feet, causing them to swell. This swelling can happen for several reasons, such as heart problem. It can be due to cardiac-related issues. It can be due to liver-related issues. It can be due to kidney related problems. It can be due to thyroid related illness, or it can be due to some clots which can happen in the big veins of the legs. So body fluid can be divided into two main areas, one within the cells and outside them. So the outside area includes the space around our cells and inside our blood vessels. Edema or swelling occurs when there is a problem with how fluids are distributed between these areas. Uh, if we discuss how this problem can happen, it can happen if too much of pressure which builds up in the blood vessels, often due to cardiac related issues or due to excess fluid administration or excess fluid intake. It can also occur if there is deficiency of proteins in the blood, like albumin. Basically, this what does this albumin do is it keeps the fluid within the vessels. Thereby, it prevents the extravasation of the fluid, leading to accumulation. So that again, it falls into a nutritional category, or it can happen due to liver disorders, or it can happen due to kidney-related disorders, wherein there will be excess leak of protein through the kidneys. Additionally, the lymphatic system normally helps to move extra fluid and proteins back into the blood. But if this system is not functioning properly, also fluid can accumulate and it can lead to swelling. And as we know, kidney plays a crucial role in regulating the body's fluid balance. A kidney helps to remove waste and regulate fluid balance. When it is not functioning properly, definitely there will be accumulation leading to edema, as we see commonly happening in conditions with chronic kidney disease. And also, if there is excess leak of protein through the kidneys, which we define as nephrotic syndrome, and if there is temporary shutdown of kidneys, which can happen due to infections or usage of medications, which we call it as acute kidney injury. So, and it is edema is considered as one of the major symptoms of CKD. So, edema can be generalized or localized. Generalized, I meant saying it can affect the entire body or large areas and is often linked to conditions such as cardiac failure or renal failure, this can also happen in liver failure. Localized edema, wherein it affects the one particular area of the body, it is often due to inflammation, blocked lymph fluid flow, or issues with the blood flow in the veins. During a physical examination, often a clinician looks for pitting edema, which means indentation happens after pressure, which can indicate edema of the following conditions like heart failure or nephrotic syndrome. Non-pitting edema, basically, it happens due to lymphatic obstruction, or it can also be seen in hypothyroid conditions. In the case of renal disease, suppose if you are suspecting edema secondary to renal disease, we often ask for few of the blood investigations like CBC, renal parameters, urine analysis, urine for microalbuminuria, and urine for albumin creatine ratio. And the most important, the gold standard is 24-hour protein. Accordingly, we will categorize into three stages: microalbuminuria, uh, normalbuminuria, microalbuminuria, and macroalbuminuria, okay, which is also considered as severe proteinuria, mild, moderate, or severe. In this way, also we can divide. And once renal conditions are suspected, we will ask for further investigations like ultrasound imaging can be asked. So, and often this has to be clubbed with a thorough history and physical examination, which helps in identifying particular cause and helps in guiding the management plan. So when it comes to managing edema, there are basically two approaches. One is non-pharmacological treatment and the other one is pharmacological treatment. So often when we tell about non-pharmacological treatment, definitely it gives some positive vibes to the patient so that always he wants some non-pharmacological treatment when compared to pharmacological. So always it should be an add-on to a pharmacological treatment. So, what are the non-pharmacological measures? Basically, it includes limb elevation, wherein we should advise the patient to keep his limbs elevated by keeping one small stool or on sleeping while sleeping. He can keep a pillow below his limbs, which helps in reducing the swelling. And compression therapy by asking him to wear compression stockings, or he can also use crepe bandage also. And physiotherapy, massage and other physical therapies can be performed by trained professionals. And ice application, useful in severe or congested edema secondary to infection like cellulitis. So, if the cases is secondary to systemic causes such as CKD, basically the treatment focuses on reducing fluid retention and basically addressing the underlying condition. This includes salt restriction, limiting the salt intake. Often they say that if a patient develops an edema, they have to restrict at least 2 to 5 grams, 2 to 3 grams per day salt intake, and compared to 5 to 6 grams per day. So this helps in reducing the fluid overload and use of medications. These medications can be divided into different types: loop diuretics, thiazide diuretics, and potassium sparing diuretics. So in loop diuretics, the most commonly which we use are furosemide and torsemide. So often preferred for their effectiveness and longer duration of action. And both are available as oral or IV medications. IV used in patients who are hospitalized requiring immediate fluid management, and oral can be given on OPD basis. Thiazide diuretics, the commonly which we use is metolazone. Basically, it used as an adjunctive therapy for enhanced diuretic effect. Potassium sparing diuretics like spironolactone can be used. The choice and dose of diuretics depend basically on several factors like severity of the edema, the patient's hemodynamic status, and kidney function. So it's important always we use diuretic cautiously to avoid complications like hypokalemia, hypotension, and electrolyte imbalances. So once we start any patients on diuretics, we need to carefully monitor for the above parameters, and we have to address the required doses as and when it is required. So in CKD, in brief, how do we manage is basically with the above measures plus salt and fluid restriction and use of high dose diuretics. So always a patient education is crucial. Understanding the condition, following the treatment plan, and making a lifestyle changes definitely can improve the outcomes. So always better to recognize early so that it helps in addressing or it may helps in taking proper decisions, which helps in preventing further complications. So join us in recognizing National Edema Awareness Day, which will be held on September 25th, basically to increase the awareness and promote early detection of edema and related conditions. Together we can manage and understand edema better. Thanks for watching.